in which a child displays a continued pattern of uncooperative, defiant, and sometimes hostile behavior toward authority figures that disrupts the child's day-to-day functioning. So we all know, especially those of us who have children, grandchildren, nieces, nephews, that children are defiant from time to time. Based on the developmental stages that many of us are familiar with, children are particularly defiant between the ages of 2 and 3 as they begin to learn more about what they can and cannot do, and they start to see, try to work barriers and see, how far they can go and test in the waters. Teens are also defiant from time to time as they go through puberty and different experiences of a teenager, but this is not considered oppositional defiant disorder, which is also known as ODD. ODD is a behavior that is specific to authority figures and occurs so frequently that children are unable to function normally throughout the day, including in school and family activities. Data indicates that children who are diagnosed with ODD as early as 8 years old, data suggests that they are diagnosed as early as 8 years old. Most children and teens who have ODD have at least one of the following: attention deficit hyperactivity disorder, ADHD. They have anxiety disorder or obsessive compulsive disorder, learning differences, impulse controls, or they have mood disorders such as depression. This is not always, but it is pretty common. Studies show that about 30% of children who are diagnosed with ODD develop a more serious behavior condition called conduct disorder, which is an added ongoing pattern of aggression toward others, and it develops into a serious disrespect for rules and social norms in the home, school, communities, and with their peers. Differences between ODD and ADHD. Unlike ODD, ADHD is a neurodevelopmental disorder that causes a person to be easily distracted, disorganized, and excessively restless, whereas ODD is related to a child's conduct and how they interact with authority figures, family, and friends. So for those who are familiar with the two, you are aware that ADHD is often explained as being a serious behavioral issue. So because of that, it's important for us to know the difference between the two. Causes of ODD. Developmental theory suggests that the problems start when children are toddlers. The children, they say, tend to, they have a hard time learning to become independent from a parent or other person they are emotionally attached to. And in this case, the child or the teenager is considered normal, are considered normal developmental issues that are lasting beyond their toddler years. So it kind of just expresses that the child just doesn't grow up. They don't behave the age that they actually are. And then there's the learning theory, which is the negative symptoms of ODD that are learned attitudes. It says that behaviors are mirrored effects of negative reinforcement methods used by parents or caregivers. Negative reinforcement increases the child's ODD behavior because they are allowed to get away with their negative behavior. And then there's brain chemistry, where it is suggested that it's some kind of brain chemical or neurotransmitters that are not working correctly. There's family history. This is suggesting that it's hereditary. Family issues, where it suggests that ODD is developed in a dysfunctional family because of substance abuse, inconsistent discipline, etc. It can be from peers, getting the attention from peers, and getting a rush from the reinforcement of behavior. It is suggested that some children will outgrow ODD, but for the most part, they will continue to struggle in managing their behavior throughout their adulthood. It is imperative that specialists are contacted and, you know, again, as I was saying, when we were talking about RAD, ask questions until you understand what is going on with your child. It is very important that you seek the help and that you ask questions, understand what is going on with them before they leave that room. Risk factors to consider with ODD are history of child abuse and neglect, parent or caregiver who has mood disorders or substance abuse such as alcohol or drugs, exposure to violence, inconsistent discipline or lack of adult supervision, instability in their family, which could mean be from divorce, it could be from moving around a lot, changing schools, or parents have also have ODD themselves, ADHD, or some other behavioral problem. Some of the symptoms that occur with ODD may include tantrums, anger and irritability, loss of temper easily, outbursts, argumentative, disrespectful, defiant, vindictive, spiteful, blames others for their mistakes, low self-esteem, antisocial behavior. They can be very impulsive, risky with drugs and alcohol, suicidal, okay, I said all of those. So those are some of the things that you can look out for. And again, we're talking excessive, not things that happen once a month or, you know, 2-3 times a year. This is something that is so excessive to the point where the child is having a difficult time functioning on their daily, day-to-day basis. When it comes to the diagnosis of ODD, this is another one that is not the easiest to diagnose. If a parent notices that their child has symptoms of ODD, they should contact a professional as soon as possible. An evaluation from a psychiatrist or other qualified behavioral or mental health professional would be in order. It's important to make sure that you get this diagnosed as soon as possible because it could turn into some other types of disorders. Another thing that is important to realize as well is that when children have ODD, there could be other disorders present, which is why I say it's important to make sure that you get them checked out because it may be ODD along with other things, or it could be other things that just look like ODD. So some of the things that, or disorders that could be present along with ODD could be ADHD, a learning disorder, mood disorder, or an anxiety disorder. So making sure that you get the proper diagnosis is important. Treatment for ODD, it varies and it would depend on your child's age, the severity of the symptoms. It would depend on whether the child is a teen or younger. Whether they have conditions that include what we were just discussing, ADHD, learning differences, OCD, and whether or not the child or teen has the ability to take part in or tolerate particular types of therapy. And some of those treatments may include parent management training, which is the main treatment, which teaches parents ways to change their child's behavior in the home by using positive reinforcement to decrease unwanted behaviors and increase healthy ones. Psychotherapy, which is talk therapy, which is a variety of treatment techniques that work to help identify and change troubling emotions, thoughts and behaviors. And this is typically done by a psychologist, psychiatrist, or behavioral and mental health therapist. Cognitive behavioral therapy, which is CBT. This is structured, goal-oriented individual therapy that helps the child look at and unlearn their negative thoughts, emotions, and behaviors. And then there's family-focused therapy, which is a therapy that is for the child and the family to work together on communication and problem solving. There's also peer group therapy, which is just social and group therapies that are done with therapists who work with kids of the same age or age group. There's school-based interventions, and there's educational tools that can be used for teachers and people in the school who will be able to also make sure that the child is getting assistance while they're in the classroom. And then there's there's medication, which is not specific to ODD because there is no medication for ODD. Rather, it's something that may be able to help with the other conditions such as ADHD, OCD, or depression. Because researchers are not sure what causes ODD, it's not possible to know exactly what you can do to prevent it. However, if the symptoms are recognized and addressed quickly, it can minimize the difficulties that may come along with having ODD later. How to help your child if they are living with ODD. Build on positives. Caregivers should give their child praise and positive reinforcement when they show flexibility and cooperation. They should offer awards for good behavior, especially for younger children. Be consistent. Make sure that you set reasonable age-appropriate limits with consequences for poor behavior that can be reinforced regularly. Model the behavior that you want the child to have. Avoid power struggles. Sometimes fussing with the child is not as important as making sure that the child is okay. Set clear limits and boundaries. Make sure that rules, requests, and tasks are clear so that there's no confusion, eliminating the reason why a child would not be successful at what they have to do. Follow consistent schedules and routines. Consistency is extremely important when you're dealing with a child who has any kind of disorder, particularly when you're dealing with children who have behavioral disorders, such as ODD. Make sure that everyone who participates in the child's daily activities are working together and are on the same page. Set the child up for success. Make sure that when you have an opportunity, you set things up so that they can be successful. So certain chores that you know would be easy for them to accomplish, do that so that they can feel like they can do things without messing up all the time. Be patient. Progress takes time, and sometimes you'll see it right away. Sometimes you won't see it at all, but you can trust and believe that if you're putting in the work with the child will eventually fall in line and things will work. Finally, parents and caregivers must find time for themselves and find support for themselves. Being a parent or caretaker of any child can be difficult, but it's even more difficult when it's a child with a disorder of any kind. And in this case with ODD, it makes caretaking more difficult. And it is absolutely necessary for the caretaker to take care of themselves, or they will not be able to take care of their child to the best of their ability. And that is all that I have.
So one of the questions I had in there was, have you seen EMDR being used with children and teens with ODD? So eye movement therapy, or some of the attachment therapies. I know that it's not reactive attachment disorder, but have any of the attachment therapies been used for children with ODD?
I personally have not seen EMDR used, but I've been researching it. So I know that it's there and apparently it's successful. So that's something that I would suggest a parent learn more about if that is, an option for them. And I mean, when you're dealing with any kind of disorder, whether it's RAD or ODD, I guess at any point a parent would be kind of desperate to try whatever they see or hear is doing some good work for children. And all kids are different, so you're more than likely going to have to go through 2-3 different things before you finally get to what works for your child, and that's okay. So I haven't personally seen it, but I have researched and saw that it's doing some wonders for kids and adults.
And tomorrow we're going to talk hopefully a little bit about the effect, as you were talking about, the effect on the family, not only the parents, but the siblings and others, because it can have a dramatic effect on, everybody in the family. With a child with both of these disorders. And, a lot of times focus gets placed on the child, who is experiencing it, but the other children need to be, focused on as well, because they are being affected. So we'll just talk about some resources that families have used that might be helpful, not only for the child affected, but the family members, the siblings and others. All right. Does anybody else have any questions? Anything they want to comment on?
Oh, we've got some thank yous coming into the chat. So we definitely want to thank you. Yeah, this was wonderful. We look forward to seeing you again tomorrow. More thank you.
I look forward to it.
And if anyone is interested, when I send out tomorrow's PowerPoint, I will also send the information for her organization, Tomorrow's Change. So she is a beacon in the community. She's one of our mini grantees for this year. So really excited to have her in the community and continue to create the community. So tomorrow, thank you so much. We'll send out.
Thank you, ladies.
Yeah, absolutely. And then everyone will see you tomorrow at 12 for the learning community. So that'll be with our FLN members tomorrow, Tina and I, and then some community members will also be attending. So we look forward to seeing everyone there. If you think of any questions, we will. Oh, no, that's okay. And then thank you, Brittany. And then we will close with our second poll. Look, these FLN
thank you.
I need it. We will get better. We'll get there. Mary, if you want to send out that second poll now, that would be greatly appreciated.
We're going to do the poll, and then we're going to do the evaluation. So the evaluation is in general on the webinar, and that just helps us with the planning of future webinars.
And as Tina mentions the planning of future webinars, we'd also like to say that our last 2 webinars, so this one and the FASD, those were both requested by our community. So if there are any topics or things that our group is thinking of, is experiencing, has in their mind, is being pulled towards, sees it in their community, please send it our way. We are looking to continue to grow in the support of our families and our community members, all of our loved ones in the communities that have children with special healthcare needs. So if there's anything that you all are looking to learn about or hear more about, please don't hesitate to share that, okay?
And it doesn't have to be a main topic. It can be a topic that crosses across communities. So something like sleep problems or challenges that you are having or you have heard about in the communities that you are a part of. So, you know, we want to bring you information on different disorders and different things our community as a whole are facing, but also we want to start tapping into resources for things that are commonly are common concerns. For example, at a recent conference day that we had, you know, we talked about the challenges of summer and childcare and camps for children with disabilities. So, you know, it can go across the, you know, communities and be a common challenge as well. So I'm going to end this poll and then I'm going to bring up the evaluation.
Oh, and it looks like everyone has answered the poll. So I'm gonna end this one, Tina. Oh, you got it. It sounds like everyone is jumping off. We just want to thank Tomaro again for coming out, virtually, of course, but still spending time with us this evening. Really, this has been great, and this is something that not everyone is getting to talk about, but a lot of people have questions about. So thank you.
Thank
we
you.
look forward to seeing everyone tomorrow, and tomorrow we will also see you tomorrow.
Yes.
And if there's anything and unintentional play on words, but we do look forward to seeing you again.
Okay. Have a good night.
Yes, you too. Thank you.